Pharma presented with a black mole. There is a mole present over the cheek, that is over the face. It increased in size, so size is increasing and it became irregular. And now you can see there is one more clue. It invaded the deep tissues. So all the important clues I have highlighted if you can observe carefully. So the age is there, there is a mole present over the cheek, that is face, and the size is increasing, and you can see there is this clue which is mentioned here in this question. Whereas if you see this question, so this also almost looks the same. 35-year farmer, black mole on the cheek, increased in size. But if you observe carefully, the last clue which was there in this MCQ is absent in this question. Okay, so the answer for this question number 383, that is today's MCQ which I asked in the telegram, is not superficial spreading melanoma. Why? Because if you observe this question which is having black mole on the cheek with increasing in size, the answer for this question is superficial spreading melanoma. Okay, the answer for this question is option B, superficial spreading melanoma. But in this question there is an additional clue which is given, that is this particular melanoma is invading the deeper tissues. It is invading the deeper tissues. So the answer here is option number C. So you should be also in a position to rule out the options. So it is not option B, for obvious reason. Why? Because acral lentigo melanoma, acrodermatitis enteropathica, I hope you remember, where the children, because of the zinc deficiency, they had dermatitis features over the extremities, acrodermatitis enteropathica. So acral, wherever you see, you must remember that it is associated with extremities. And here in the MCQ you can see clearly it is mentioned that cheeks are having a black mole. So you can directly straight away rule out option B. And also, why is it not option D? Because superficial spreading melanoma, despite being most common type of melanoma, despite being present over the face most commonly, the superficial spreading melanoma will be superficial. It will not usually invade the deeper tissues. Okay, so that is one more reason why it is not option D. Now let us look at option A and option C. These are very close differentials. And why is it not lentigo maligna melanoma? I will tell you. There is one reason, that is age group. Observe carefully, the age in this question is 55 years. Okay, so now let us see. So I just felt that these two MCQs which are very close looking, but they are different. You can remember that this is Amitabh Bachchan, this is Sonu Sood, and just like this, the MCQ, many students I can see have thought that it is superficial spreading. As you can see, most of the students have answered it as option D, that is superficial spreading. But I just want to tell you, so you should also know the knack of the examiners. By just adding some clues and removing some clues, the answer can be entirely changed. So you should remember that you should not just mug up, or what we can say, you should always try to understand the concepts behind the MCQ. That is theory. If you can understand the concepts, then you can apply that in the MCQ. That is the reason why reading notes and revising is also important, and also the application, that is this grand test and subject wise test, and also reviewing this test is also very important. Okay, so now let us look at each of these type of melanoma in brief. Okay, superficial spreading, as I have already told you, this is the most common overall most common type of the melanoma, and this is most common type in the pre-existing mole. It is most common in the pre-existing mole. And you must remember that why is it called superficial? Why is it called superficial? Because there is going to be a horizontal growth phase more than a vertical downward growth phase. That is, here melanocytes are proliferating, and they are dividing, and they are becoming cancerous. That is uncontrolled proliferation and division will be there, and that is going to be seen mainly in the horizontal phase. That is, horizontal growth phase will be there, but not vertical in the case of superficial spreading. And I hope you all remember the concept of nodule, so I just don't want to go. So nodular melanoma, why do we call it nodular melanoma? Because instead of the horizontal growth phase, that is the melanocytes growing sideways, the melanocytes are going to involve the deeper layer, that is the deeper tissues will be invaded. There will be a breach in the stratum basal, and that is the reason why this is going to have the worst prognosis. I hope you all remember from your reading melanoma in the surgery topic, that is Breslow's and Clark's levels are important in the prognostication of the melanoma patient. So because this is going to have a vertical phase, that is the downward growth of the melanocytes, this nodular melanoma has the most worst prognosis out of all the types of melanoma. And I have already gave you one hint to remember the age of the patient in this question. So if you observe carefully, the age of the patient in our question was 55 years. So you can see this is from Bologna superficial spreading. It is the most common variety, and the median age is above 50 years, 51. And nodular melanoma, it is the second most common, and you can see the median age group is 56 years. Whereas Lentigo maligna melanoma, which is in fact a close differential for this nodular melanoma, the age group is above 65 years, that is 68 years. Okay. And of course acral is 60, the above 68, but that's not important. What we are concerned is that Lentigo maligna melanoma, the age group is above 65 years. So a few points about nodular malignant melanoma. This is the most aggressive variety of melanoma, and this has the worst prognosis among all the types of melanoma. And acral melanoma, acra means extremities. Just remember this point. Now coming to Lentigo maligna melanoma, I hope you all remember the age group, that is elderly population more than 65 years. And this is in fact in situ variety of melanoma. That is, usually there will not be a breach in the stratum basal. So this is going to have the best prognosis. This is going to have the best prognosis. And in some textbooks it is also mentioned as Hutchinson's melanotic freckle. Hutchinson's melanotic freckle. I hope you all know that ABCDE concept is used for malignant melanoma. And in yesterday's question I asked the genes which are associated with psoriasis and